welcome to our new series, Treatment Zaroori Hai, which is brought to you by Meril in association with Times of India. I'm your host, Paramita Chatterjee. Now, our focus on the series and on the show today is about arthritis, which in simple terms is a disease causing painful inflammation and stiffness of the joints. In arthritis, it's osteoarthritis, which is the most common form of the disease. And it's estimated, as per some government statistics, that more than a third of our population suffers from this form of arthritis. In fact, it affects women usually more than men, especially women above the age of 65. And we'll discuss all of that with our doctors. In terms of the joints that osteoarthritis impacts, it's a lot to do with our hands, hips, as well as knees. Unfortunately, most, if not all of us, know somebody who suffers from arthritis. But it is a disease which most of us seek treatment only when the pain becomes unbearable or the bone has degenerated or worn out to such an extent that it affects our daily life. But that need not be the case, especially if we seek timely treatment and address the disease with the latest means and technologies available before it is too late. So let's find out how and why treatment Zaroori hai when it comes to arthritis. And it gives me great pleasure to introduce to you some of the foremost orthopedic surgeons and doctors in our country today. Let me start by introducing Dr. Vijay C. Bose, who's Joint Director at AGRI Sims Hospital. Dr. D. Gokul Raj, Senior Consultant and HOD Orthopedics at Fortis Hospital, Vadapalani, Chennai. Dr. Bharat L., Senior Orthopedic Surgeon at Bharat Orthopedics, also Chennai. Professor Dr. V. Singara Vadivelu, who is Senior Consultant Orthopedic Surgeon at Noble Hospital. And Dr. Bharani Kumar, who is Senior Orthopedic Surgeon at Apollo Specialty Hospital at Vanagaram, Chennai. So doctors, many thanks for joining us today on the show. Let me start with you, Dr. Bose, and let's learn a little bit more about arthritis, particularly osteoarthritis. What is it exactly? How do you explain it to your patients? And what's the most common joint which is typically impacted by osteoarthritis?
Thanks. So osteoarthritis, you'd be surprised to know, is actually wear and tear of the joint. So sometimes we tell our patients, it's like your hair going gray. So it's a part of life. So anything, physical will have wear and tear over time, and so do our joints. However, some people are prone to develop this in a prematurely, and that could be various reasons. You're more obese, lifestyle causes, your diet, etc., lack of exercise, and so many other things. But can accelerate a natural process which occurs, when you get very elderly, 70 plus. But these days, because of faulty lifestyles, you can have it very much younger. And then we find that every passing decade, we find that patients are getting younger and younger with osteoarthritis. And as you had mentioned in the introduction, it's rampant now. Probably 1/3 of our population is suffering from premature osteoarthritis. And the commonest joint that is involved is the knee joint. Now, as you know, many medical disorders have a genetic predisposition, and so does osteoarthritis. It may have a run in your family for early osteoarthritis to develop. So slowly you find that the joints become painful, especially the knee joint. And you find that this is wear and tear, but it becomes accelerated. So early in the disease process, you'll find that you get pain occasionally on exertion. Then you get pain on a daily basis. And then you start getting pain at rest. And then it's very severe pain that it disturbs you from sleep. And these are the various stages in which the disease is progressing. And at some point, that if you don't get the proper intervention, you are really in trouble. So that's sort of a nutshell on osteoarthritis.
No, and I think that's explained so wonderfully that basically this is a progressive disease. It might have, some sort of a genetic aspect also. So if my dad has bad knees, I have, a greater likelihood of also developing osteoarthritis in my knees. And this is a disease that progresses, which means that if we don't do anything about it, Dr. Gokul Raj, let me come to you here because, explain that to us in terms of treatment. Many of us ignore, especially knee pain. We are like, maybe it'll go away. I'll, put some, crepe bandage or put some balm on it or just take a painkiller. But explain to us, what are the kind of treatment options which are available? Because today we are talking about treatment Zaroori hai. And people need to get that message that, if you are getting that pain in the knee, then you need to go for treatment. So what are those treatment options available, particularly in India today?
So regarding osteoarthritis treatment, so first of all, when you have knee pain, the first thing is to have medical help. It is better to have a doctor or an orthopedic surgeon to examine the patient and then come to a conclusion what exactly it is. Because doesn't mean that every patient should have osteoarthritis. That's number one. So it could be also a referred pain to the knee. Because if you have a pain in the hip joint, it can also affect your knee. It can produce pain in the knee. So first of all, you need to get a medical checkup, and it has to be the examination has to be done. Regular necessary X-rays has to be taken, and to find out the real cause of the pain has to be ascertained first, and then comes to the treatment part. Okay, treatment part as such, if you look at it, there are multiple options available. So if you're talking in terms of only osteoarthritis, we have to find out what is the real cause. Okay, osteoarthritis could be primary or secondary. In other words, it could be due to a pre-existing condition, like if you have a fracture in your joint, and that can also lead to a secondary osteoarthritis. Or it could be due to a disease process, like arthritis, like rheumatoid arthritis, psoriatic arthritis, and other arthritis, which can also lead to a secondary osteoarthritis. So it is better to find out what really creates the problem. So that's number one. So an X-ray is the most important thing with which you will be able to find the diagnosis. Next, coming to the treatment part of it. So if it is going to be mild, usually the first line of treatment is going to be in the form of medications, that is some painkillers, as well as physiotherapy, as well as some exercises, especially to strengthen your muscles around the knee joint. So this will help you to propel faster and move. So this is one thing which will be done. If it progresses more, if the staging is more, then there are other interventions. So the interventions could be in the form of an injection into the knee joint, otherwise called as viscosupplementation. There are other injections which could be used called as PRP, as well as the BMAC, which is bone marrow aspiration, which could be used. So these are all various interventions which could be done. And then comes to the stage of surgical intervention. So surgical intervention is necessary once the joint surface is completely damaged. So it could be in the form of, there are surgeries which could be addressed only to the axis of the joint, axis of the bone, which could be corrected. That's called as an osteotomy, and it could be corrected. Or if the joint is completely degenerated. So if you look at the knee, you have three separate joints in the knee. So one is the inner aspect, the outer aspect, and one which sits on top of it, which is called the patella. All three surfaces can get degenerated over time. And if these three parts are involved, then surgery is the ideal choice. If you're talking in terms of a surgery, what I'm trying to tell is total knee replacement will be the ideal choice.
Okay. We'll talk a little bit more about total knee replacement surgery, but I think first and foremost is whether it is the knee, whether it is the hip, if you're having a pain, and if you've had some family history or some sporting injury, or if you're above the age of 60, 65, basically you are in advanced years, then you should get it checked out, go to a doctor, and preferably an orthopedic doctor, and get it checked out. And then there are the various stages of treatment, because let's understand a little bit more about this. Let me go across to Dr. Bharat now. Dr. Bharat, my question to you is that, we just heard from the doctor. So today we are talking about osteoarthritis, which affects the knees, the hips, and it's the most common form of arthritis. So if you can explain to us in greater detail, but there are also other kinds of arthritis that exist, right? We spoke about rheumatic and other aspects of arthritis. Explain to us, when we talk about arthritis, do they all follow these stages? The first stage, second stage, third stage, much like other diseases. Can we categorize various stages of arthritis?
Yeah. As rightly said, as we are discussing before, when we say arthritis, even though it's a medical word, but I would say it's more kind of a layman terminology. So it's from the patient perspective, they have the rights to know what type of arthritis. The first thing is when a patient says that he has an arthritis, he should have the awareness of what type of arthritis. So when we say osteoarthritis, commonly patients say osteoarthritis, arthritis. So when we say we can classify arthritis into the primary form and secondary form. So when we say it is primary form, it is mostly a wear and tear phenomena, but it is age-related process. Means we call it as degenerative process. So in that, if we classify it is actually not a disease per se, because it's part of an aging process, like the grayness of your hair, skin wrinklings. You grow older, it's a part of a natural degenerative process. So first is the point the patient should have the knowledge what type of arthritis. So second, when we say the secondary forms, the secondary forms is more pathological forms. So what is pathological? It is a disease process. It is an ongoing process. So the first is the foremost, we can call it as a rheumatoid arthritis. The other forms are like psoriatic arthritis, gout induced arthritis, or sometimes post-traumatic. So sometimes you have an injury in and around your knee joint. So that has increased the wear and tear phenomena over a period of time. So these things are classified into a secondary form of diseases. So first is the patient interested to know what type of arthritis, and the treatment protocol is going to go based on what type of arthritis is. Suppose we say rheumatoid arthritis, like psoriatic, they are called autoimmune diseases. So they are called autoimmune. What is autoimmune means? Certain antibodies are formed against our own bodies.
Right.
And when it says rheumatoid arthritis, it is not just particularly the joints are particularly only affected. It can affect your eyes, it can affect your heart, it can affect
So
your
those are
spine.
basically autoimmune kind of diseases where your own
Diseases.
immunity is attacking you. But today we are here focusing a lot on the largest group of arthritis where we are
That is
seeing
primary osteoarthritis.
that's osteoarthritis. And when we talk about osteoarthritis, doctor, how large is the problem in our country? I mean, I just picked up one statistic from the government ministry saying that, for women, it occurs in 65% or 70% of women above the age of 65 eventually do develop osteoarthritis. But now, as somebody said, it's happening in younger and younger people.
Yeah, that is as you rightly said, no one can escape from arthritis. When we say osteoarthritis, it is going to be what stage of you are going. If you are going to you're going to live for a period of 80 years, of course, there is going to be some amount of arthritis. So certain patients, maybe are young active individuals who are highly sports active, so they injure the repetitive injury to the knee joints at a younger age groups are have a more predispositions to early osteoarthritis. This is one group.
I mean,
Of
the
course,
sportsman, doctor, I think, we have Andy Murray. He had a hip replacement, right? If I'm not wrong, because of, repetitive fractures to his stress on his hip due to, and developed osteoarthritis, which impacted his game. He's a very famous tennis player.
yeah,
And
it happens to every individuals, obese individuals nowadays. The concept of weight reductions, people are into highly active physical therapies. They run a lot. Morbid obese individual running, it's of course going to have a negative impact on his or her knee
but
joint.
tell me, doctor, one only hears of surgeries happening to, say, athletes. Like I mentioned, Andy Murray, Rafael Nadal, our very own Saina Nehwal. Of course, she had a different kind of knee injury. But, one doesn't associate surgeries as very commonplace kind of treatment, particularly when it comes to hips or especially for the knees. Is that the right perception to have?
Yeah, that is the reason that this kind of awareness should be always into a process. So that even at a young age, if I have an ligament injuries, so that ligament injuries have to be addressed at the early stages. Suppose neglecting such kind of injuries, like we have something called as a ACL ligament, we have a meniscal kind of a soft tissue structures inside the knee. If these structures get damaged, and these are the structures which are essential for keeping your knee joint quite healthy, and such soft tissues are injured, so higher the chance that you get an early osteoarthritic changes.
So in such a case, lifestyle modification is not really going to help.
Yeah, of course. But what we actually say in our practice is, if a patient is well without any symptoms of his or his knee, we don't normally restrict most of the activities or like sitting down, cross-legging. But once a patient develops such kind of symptoms and we diagnose it to have the patient is having some kind of a minimal problem, then of course we are going to instruct them to avoid squatting down, avoid sitting on the floors, and such kind of restrictions we lay on the patients.
Okay, so I think you've explained it very well to us. So there is a group of young people, maybe because of genetics, because of sports, because of some injury in whom osteoarthritis develops early. But the majority of cases, and Dr. Bharani Kumar, let me come to you here, would it be right to say that the majority of cases that we see of osteoarthritis, especially in our country, is as far as senior citizens are concerned, or the geriatric age group? Tell us a little bit more about that age group.
You're right. Actually, looking at arthritis, we're looking at osteoarthritis, we're looking at the wear and tear. And the wear and tear actually happens as we get older. It's a natural process. Everyone said before that as we get older, you're going to have wear and tear. The cartilage gets worn off. So they start getting pain, initial symptoms there. What we need to explain to most of the patients that not all patients with osteoarthritis are going to get knee pain or joint pains. That's first thing. And even if they have joint pain or knee pains, not all of them will need to end up in surgery. That's other thing that they need to know. So it always depends on that. We need to know the grade of the disease or the severity of the disease. And as we get older, and once the stage of the disease progresses, that's what will happen as we get older. And then those are the patients who tend to either they ignore the disease and carry on because they're just scared of surgery and they continue carrying medications or doing conservative means. And they come to a stage when they cannot do the daily activities. I think that's when the things comes to this point.
And there's also another psychology, they say that, we are just getting on in years, then, this is anyway going to be our quality of life. I mean, should they really accept the kind of pain and stiffness and lack of mobility just because they are senior citizens or they're geriatric patients because of osteoarthritis?
I think what we need to tell patients is age should not be the criteria for a cutoff, saying that you're old for surgery. I think you look at the other conditions. As long as they are medically fit and well, and if the joint is or the knee pain is what is stopping them from walking or doing their daily activities, then they should be offered something which has better result than medications. I think some people wait for so many years. What happens is they are 60, they come for joint pain, they have arthritis. They say, I'm only 60, can I wait for a bit longer? They wait 65, 70, and then when they come at 70, they feel they're old for surgery. I think that's where the problem comes in. And the last 10 years, they keep suffering with the joint pain with medications. And had they thought about it initially at 60, they had surgery, then they would have a 10 years pain-free life where they could have walked mobilized normally.
Absolutely.
So
let's take a quick break, Dr. Bharani and the rest of you. Let's take a quick break, doctors, on that note. Welcome back to our special series, Treatment Zaroori Hai, brought to you by Meril in association with the Times of India and Paramita Chatterjee. And we've been having a fascinating and illuminating conversation about what is osteoarthritis. Why is it important that you and I are aware about it? And more importantly, why is it important to get timely treatment? We've got a host of very well-known orthopedic doctors with us who've been talking to us and explaining to us this disease, the treatment options, and how it can affect any age group, but particularly senior citizens are people who needlessly suffer without opting for some of those options. But now, senior citizens are clearly the largest group. We've got with us Professor Dr. V. Shingara Vadivalu, who is here with us. And Professor, if you can tell us, one is, of course, the geriatric patients and patients in whom, because of the progression of age, the joints are also getting worn down. But what about young arthritis, patients, especially those who've had an accident, or maybe they are, athletes and they've injured their knee or their hips? What happens to them? What is the kind of osteoarthritis progression and the treatment options available?
For the young people, there are two kinds of people. One is who is aware, who is very much worried about their knee joint, what sort of exercises I have to do, and how I should manage my knee joint. The second group is a patient having an injury and how it was managed. So when we take the injury and how it should be managed, so everything is a very fine structure and you should not grossly look at any injury. So the proper treatment is very important. The biomechanics of the knee is so complicated and beautiful that if we don't try to restore whatever which has been lost, then probably at a later age group, probably in 5 years or 10 years, that cushion which is in between the bone, which is called as the cartilage, it is going to wear off faster than what it should normally do. So that cushion losing is what we call as arthritis. And that cartilage loss can happen very fast if the biomechanics is not restored to its original condition. So that is the need for treating it properly to avoid a later arthritis. Because India, it is more prone for knee arthritis when compared to the Western population where they have more arthritis at the hip. So we see more of knee arthritis. Second is young individuals who want to maintain their knee joint properly. What exercises should I do? So when they come, when they are young and they have taken up sports as athletic activity, probably they can be running. So the cardiologist or other people, they'll say that you do all these activities aggressively so that you can maintain your general condition. But also we have to take care of the knee joint. You have to imagine that when we jump or when we run, we put 5 to 8 times of our body weight across the knee joint. Every step we are running or jumping. So if you are 60 kg, it is, you have to imagine 300 to 500 kgs of weight is going across the knee joint. So if your cartilage is not used to till the age of 25 or 30, suddenly you want to run and you want to do a marathon, and you are running in the hard topped road without a proper shoe, footwear, which doesn't absorb the shock, then the cartilage is going to bear the brunt of attack. So these young people, we have to tell them what is the right exercises to keep your physical fitness is of course very important. Keeping your body shape and avoiding obesity is very important.
In
But
fact, doctor, these days it's a craze, to go running. We have marathons happening, and the pre and post injury, especially post the marathons, is quite well known. So don't rush into some sort of sudden increase in activity. That's typically a big red flag for
suddenly you don't try to get yourself into fitness and go slow on it.
Right. That's a great point. Now let's take that across. And you mentioned a very important point that in India we are seeing more of knee arthritis, and we are seeing more people being disabled due to their knees. So, Dr. Bose, let me come to you here because we've heard about total knee replacement surgery, and this was taking place many years ago. But where are we at today when we talk about total knee replacement surgery, and when is it actually recommended for a person with osteoarthritis in the knees?
Right, that's a very great question, and there's an important message I think that we have to get across to the public. Now, the commonest thing that we see is that a patient who has got florid osteoarthritis will do extremely well with a knee replacement. They say my neighbor went to maybe some Ayurvedic massage therapy and they got well, and therefore they are going to try it as well, and they keep wasting their time. The point was the neighbor had a very early form of the disease, which could be cured with very simple means, whereas this particular patient had a very advanced form which needs the knee replacement. So the first thing that all osteoarthritis must not be put into the same bracket. So as Dr. Singarodi well said, there's a cushion or the cartilage, and over many years, slowly, it doesn't occur overnight. Osteoarthritis does not occur overnight. So many years, slowly, progressively, you're using little bit. And as the disease progresses, you need different treatments. So the first message is that depending on the stage of your disease, it is early stage, maybe just physiotherapy, some exercises. Some moderate stage, maybe some injections.
Right. Point is well taken. But doctor, when, say, for instance, many of us have heard of doctors recommending to our near and dear ones, you need to go in for a knee replacement surgery. But the big question everybody has in their mind is like, is it safe? Will I really be able to walk? Isn't it better that I just continue with the set of God-given knees that I have, rather than go in for some artificial knees, which are implanted?
So I'm coming to that, yeah. So the point is, even if it is a first visit to a doctor, it's not that you get a gradation of treatment. The treatment is based on the condition or the severity of the disease. So even your first visit to the doctor, if your disease is very, very advanced, you may need a knee replacement. So that's it. So it's a question of how bad your knees are. If the knee is very bad, the only thing that will help you, or in other words, the cartilage, the cushion is fully gone, you need to put an artificial cushion inside, otherwise it's not going to work. And that's the fundamental point. Like everything in life, cars 15 years ago, it can't be compared to the cars today. The technology in every sector has advanced very well, and so in knee replacement. So earlier it was more, the patient didn't have good function after the surgery. Now patient get excellent function after the surgery. They can do whatever they want. They want to sit on the floor. And these are a lot of misconceptions about.
How soon can they walk?
They walk on the same day, actually. The morning of the surgery, we do the surgery, the evening they walk. And just like the knee replacement techniques, the technique of anesthesia or all the technology surrounding the knee replacement has advanced to a very high degree. that, the pain, one of the other common misconceptions is that the pain is very high, but our anesthetic colleagues are able to manage the pain very well through very many techniques, and therefore they're almost pain-free. They can walk the same day. They can go home in 2-3 days' time. They're very mobile. There's no need for anybody to look after them. So like in any other sector, tremendous advancements have taken place, but this has not reached the public.
It's a learning for me that you have the surgery in the morning, and in the evening you can actually be walking, and walking perhaps much better than what you did.
Absolutely, yeah. So it's a very advanced science now. Knee replacement surgery. We have so many advances. The techniques.
And we'll discuss all those advances with you, Dr. Bose, because I know that you have some special expertise, especially with some of the latest advances. But let me go to Dr. Gokul Raj here. When somebody is told about surgery, one is, of course, the person has to be mentally attuned, he or she, that I'm going to go in for surgery. But what are the other do's or don'ts, whether it is knee replacement or hip replacement, before any joint replacement surgery?
The very first thing is, before we put any patient to surgery, is first thing is patient should understand the problem, number one. Because hip replacement surgery, knee replacement surgeries, what the do's and don'ts will slightly vary. Okay, so first understanding the problem. Problem number one is that patient accepts that he has this problem, and then you go for the surgery, because it gives a lot of importance to the patient, because he knows what is his problem, so that if we tell him what has to be done, he'll start listening. That is number one. So patient has to accept the problem, and that has to be done. Next is, so for in general, if you're talking about knee replacement, patient's mobility is more important. Post-operatively, we have to put it, because as Dr. Bose said, that the same day the patient can start walking. And he should be motivated. He or she should be motivated to do that. And most important thing is the fear of pain. In today's world, with a lot of advanced techniques of injections into the joint, patient will be able to walk the next day. And they have to continue doing the exercises, especially of moving around their knees, like bending it and straightening it. And they have to continue doing it. And they can even walk. They can even climb stairs within a couple of weeks. So it is all possible with a knee replacement.
But what you said, the patient has to be cooperative. He has to be part of this journey.
Yes.
And that is why we want people to be aware that treatment Zaroori hai. Treatment is there for, especially for those whose knees have completely worn out, because there's so much of reluctance. So, doctor, you said that, a patient can walk actually the next day, or maybe that evening itself. Having said that, let me go across to Dr. Bharat now, that, when one has had their knees replaced, either one or two, or even had a hip replacement, how long does an implant actually last for?
Yeah, a good question. When we say implant, it is a processes, it's the artificial processes what we are speaking about. So at present, most of the processes are FDA approved, and most of them are imported from the Western world. And when we say a well-done knee replacement, a well-done knee replacement should last for more than 20-25 years. So that is what the literature says.
So,
and it has been time tested.
60 has had it done, it can last all the way till they are 85, basically.
Yeah, of course.
You've had patients like that.
Yeah, definitely. We have patients coming for follow-up after 15 years, they're coming for follow-up for 20 years. And these are not by sayings, these are all been time tested. The literature supports the survivorship of those implants. So such kind of standard implants are available. And the success or the longevity doesn't depend upon per se the implant, it also depends upon how the surgery has been executed in that particular patient.
Okay, let's take a quick break on that note. So we've learned a lot of new things. One is that treatments have really become advanced when it comes to osteoarthritis, and joint replacement is something that is easily within all of our reach. It does not cause the kind of pain that we are all apprehensive of. It can be managed. And of course, the implants are becoming more and more sophisticated. And we'll be back with more details on why treatment Zaroori hai when it comes to this form of the disease. Stay with us. Welcome back back. You're watching our special series, Treatment Zaroori Hai, on World Arthritis Day. And we are talking about all the modern treatment options available, including surgery and total joint replacement when it comes to resolving some of the pain and stiffness and lack of mobility associated with osteoarthritis. We've got a lineup of doctors today joining us from Chennai. And let's go across to Dr. Bharati Kumar, because before we took a break, we were learning a little bit from Dr. Bharat about really the kind of advancements that we've made as far as implants are concerned. Walk us through how much more progress has been made when it comes to medical technology and the kind of treatment options which are available today.
I think when we start talking about the implants, the materials which used, I think this engineering is developed last 40 years. It's changed. The implants we used probably 40 years back are different from the implants we use nowadays. And as you said, normally a well-done knee should last 20 to 25 years. And the implants, if you look at it, there are a few different implants available in the market now. One standard implant, one is made of stainless steel or cobalt chrome, which we call as an alloy. And that has a lifespan of 15 to 20 years when we say in vitro or in lab studies. And there are newer implants available as well. Some of the things are called a ceramic knee, which is called a ceramic. It's got a little bit longer lifespan in vitro. We don't talk about in patients. We talk about lab-based studies. The main reason why what is the failure for these implants or the knee replacement is as they don't have a lifelong it doesn't last a life. That means there is a lifespan to it, or there is finite lifespan. So it's a metal in between. There's a plastic and a metal. So as you use it longer and longer, there will be some wear related to that as well.
Okay, but are there some additional measures?
That's why I said the newer implants. The reason why the newer implants last longer because they have a surface which is a bit more smoother, and as a result, the friction is less, and that helps the implant to survive longer than the normal ones before. Okay. But at the same time,
Doctor, we've all, know about organ transplants where, patients have to be on immunosuppressants because you put in a foreign organ into the body. Is it something similar with implants in terms of medications that patients have to take post an implant surgery?
Post surgery, normally most of the patients, as long as they do not have any allergy to many metals. Some people, if they're allergic to nickel, then some of the implants do have nickel and it can cause allergic problems. Other than that, as a routine, we do not put them on any immunosuppressant. These patients do not need any immunosuppressant like patients who have a transplant, an organ transplant. So these patients only just need routine painkillers for a few weeks post-surgery, and following that, they normally go back to normal routine medications.
So wonderful. So it doesn't mean that they need to take some sort of routine.
They don't need routine long. They don't need those immunosuppressants. They are not required. As only allergic patients who have significant allergies or skin allergies due to nickel or something, then you'll have to use an implant which does not have nickel in it. So I think that is one of the categories just few people have problems with.
Okay, because, that was going to be my next question, before we talk about the kind of robotic surgery advancements which have happened. And Dr. Gokul Raj, let me go back to you here. I mean, what's the most common apprehension that patients have which stops them from going in for surgery? I mean, what's the biggest fear, and what do you tell them when they tell you that, listen, we are just too afraid of going in for some sort of a joint replacement?
The most important problem which the patient asks is for the pain, because the pain following surgery, because they hear the stories from their neighbors or from their relatives, and that's what it comes to. And the pain following surgery. So the simple answer which I give them is, so I operate one knee on one side, and after a couple of days later, I operate the opposite side. The question is, if suppose I operate on your knee for one side, and after 2 days, if I'm going for the other knee, will you accept it if there is pain? So then automatically the patient will know that it is not going to be painful, because after 2 days I'm going for the opposite side and doing the other knee. So automatically there will not be any pain. So this is how we do it. So in case we give them the injections into the joint so that the pain part of it is taken care of, and the patient is mobilized from the next day itself or on the same day, and the patient is walking before the surgery even, for the opposite side even. So this is the real problem about it. And there are a lot of misconceptions which goes on about pain and the problems, because the time taken for them to move around. These are the things which really put patients off, because some story somewhere with added masala that goes into them, and this has to be first cleared out to the patient, because then only we can take the patient into confidence. Because once we tell them all these things, and We also educate them by showing our patients. I always give my numbers of my patients who have undergone these surgeries so that they can talk over and get all these points from them so that their experiences matters. So once they talk with the other patients, if it's a female patient, when they talk to another lady and then find out what they underwent, then they start understanding this problem better.
I think that's a great point. Speak to somebody who's had a knee replacement or had a joint replacement rather than just rely on a third person or fourth person account. That's go to the source directly and then understand. And pain is not something to be afraid about. Because Dr. Bose, now let me come to you, because I know you have a special interest and expertise when it comes to robotic surgery, because I know a lot of people are also afraid of infections, for instance, and what it'll mean in terms of the scarring and so on and so forth. What are those changes that robotic surgery has brought into this particular field?
Right. So, like in any field, it's constantly advancing, and the latest thing that we have is robotics. And you'd be surprised to know that India has a large number of robots, one second only to the US. So the penetration has been very high here. The advantage of having the robot is what we now find is that patients are a little different from each other, and each may have to be slightly different in terms of overall alignment. So, like going to a shirt, you can buy a small, large shirt. That's okay for most of us. But a model or an actor probably would need a bespoke, made for them. So like that, we can individualize the some factors like alignment for the patient so that the function is slightly better. So that's the first role of the robot, that we're able to customize the surgery for that patient. That's important. But second thing is it gives you hard numbers, as the various technical values that we have. So when we have a robot, it tells you, it's 2.5 degrees, 3.5 degrees, etc. And that certainly builds in accuracy to your system. And since it's hard numbers, it's always good that you are, that you have a hard endpoint, that you've achieved what you set out to achieve. And the third thing is the reproducibility. And because of the same reason, we find that we're able to consistently reproduce just because, we have numbers on it. Yeah. So we're aiming for a particular goal, and then that, that you're able to achieve. So for these reasons, robotics seems to be give an advantage to patients as they're able to customize and they're able to reproduce more in a more predictable fashion. So that's the thing about robotic, but it's not essential for every patient, but it's certainly a tool that can help some patients. No question.
Okay, so and if there is an option and they can afford it, you're saying perhaps robotics stuff offers some advantages.
The other thing that robotic plays is nowadays we have got an option of a partial knee replacement so we do only half the knee. So very commonly, patients will have only one half, the inner half of the knee that's damaged, the outer half is perfectly fine. So you can just do the surgery first. So that makes the surgery half the surgery. So everything is half. So that the robot comes in very handy for that, because that again, alignment and etc. It's more important than that kind of half a knee replacement. So we use the robot extensively for when we do partial knee replacement. And that's another very useful thing about the robot.
Okay, so clearly there are new advances, and India is right there at the forefront, along with countries like the US, in terms of performing these surgeries. And Dr. Bharat, in terms of these implants themselves, you were talking about imported implants, but we are all in Atmanirbhar India today. So do we have, are Indian companies also making them? And does that impact the cost and really the kind of performance that we've seen for our patients?
Yeah, of course. For that, we say the Meril, the sponsor of this program itself, is a forerunner for that made in India process. And there are a lot of research works are still going on with making a better or an equal implant. And particularly, we are happy to say that Dr. Vijay Bose even have invented a newer implant that is going to be really a game changer. And we are into the world map of making our own implants with the standards up to the US or the Western population.
Well, congratulations, Dr. Bose and your team. And that indeed makes us very proud as Indians to know that we have our own implants, which are being made along with companies like Meril. So doctors, we could go on, and this is such a fascinating sort of journey, but I just want you all to leave a message for our viewers. And let me start with you, Dr. Gokul Raj. And, first and foremost, a requirement is that you must tell our viewers that treatment Zaroori hai. I can say it in Hindi. मैं हिंदी में बोल सकती हूँ, but today our audience is from Chennai and from the southern part of the country. So please start by telling them treatment Zaroori hai in Tamil.
Treatment ரொம்ப அவசியம்.
Okay. Treatment rumba avasiyam. That's something new that I have learned. So doctor, what is your message to our viewers?
Don't wait till the last, till your knees are bent and you're unable to walk and someone has to carry you to the hospital. Don't wait till that. Take your decision much earlier, and surgery is not painful and you can walk back normally, provided you take your decision much earlier. Accepting is first and then take the decision.
Okay, Dr. Bharat, treatment rumba avasai, what would you like to tell our viewers? I hope I've got that right.
Yeah, treatment rumba avasiyam. That is what I have to say. So the message to the common public is, first, age is not a criteria. If a patient is disabled, in spite of whatever age is, so if the treatment option is given as a replacement, one should go for it. And when it's a knee replacement, it is definitely 100% successful procedure if it is done properly in a right way. So the fear of for the surgery, one should be get rid of it. Get your knee replaced to have a better quality of life, particularly at your old ages.
Right. Well said. And now, Dr. Shingara Vadivelu, I finally got the pronunciation right, but please
right.
share with us your simple message.
Yeah. So two things I want to say. One is in Tamil, you can live without pain. Vali illamal vaazha mudiyum. You can live without pain. That is one. Second is one small story I want to say before I give a message. So recently I had one patient. I did a knee replacement and when she came for suture removal, she said she was crying. Her son was beside. Why are you crying? I just asked. She said that my son's wedding is going to be in another next month. So for that, why not? Then she said that really moved me was last year my elder son got married. So I could not sit for his marriage because it was so painful. I was afraid at that time, and my sister sat instead of me for giving all those religious function. So had I done it before, definitely I would have done all the religious function myself. And this time for my second son, I'll be able to do it. She was in tears. So that really moved me. So this kind of pain relief patients can have. There will be definitely stories from among every one of us. So this story really moved. So please seek. It is not. There is no need for any inhibition, and you can live without pain. You can walk without pain. It is not the question of only the knee joint. It is a question of entire body. You need not walk to your mall. You need not walk to the temple. But walking is so essential and important for your healthy life. It is not only for the knee. It is for your entire body. So for that sake, you need to seek treatment, and you can have your knee placed for a painless walk. That is the message.
A beautiful example there, Doctor. Thank you for sharing it with us. It's brought a smile to my face, I'm sure to our viewers as well. Thank you so much. Dr. Bharani Kumar, perhaps is there a patient story you would like to share along with the message?
More than that, yeah. More than patient story, I think the message would be that I think most patients are scared of the risks associated with surgery. I think that's one of the things which stops them from going ahead with the surgery. I think what we need to explain to the patient that there's both risk and benefit. I think we need to look at a balance between that. Everything in life has got a risk. If you walk on the road, you can have something to it. Same thing with the surgery as well. There is a risk associated. But if you look at the other side of it, you're looking at the benefit part. And if you do not operate, what happens to me? Mobility, as time goes by, your mobility is going to get poor. You may not be able to, even after surgery, even after some stage, even after the patient gets older, we still can operate. But the question will be the recovery part of it, whether you will be able to rehabilitate afterwards. So I think they should have an optimal, as I said, we should not wait for till it gets worse. I think to do it at the right time would be the best thing for them to get back a good outcome for them.
Wonderful. Well said. And the final word goes to you, Dr. Bose, since you're not only helping with surgeries, you're also creating new implants. Tell us about what the future looks like and how can the future be pain-free for patients suffering from osteoarthritis?
Yeah, before that, I'll give my message as well. So my message would be, the knee, especially all surgeries and especially the knee replacement surgery is your friend. You shouldn't think it of as, the last effort that you've exhausted all options and then you're pushed towards surgery. In maybe the 50s and 60s, everyone was scared of flying. because flying was not safe. It had risks, etc., and people had to be probably dragged onto a flight. But it's no more. Everybody is very happy taking a flight. It's your friend. We cannot do without flights today. Just like that, knee replacement today is your friend. So view it that way and take advantage of what technology that's available. And you're coming to the specific question that you asked, what is the future? Well, the future is very bright, I must say. Already our results are very predictable. Already we are able to give a very high percentage of results. There's another one that the patients are scared of, that probably their surgery would fail. But we are now very predictable. We are able to give a very high percentage of success. And in future, things are going to get more and more refined. Implants are going to get better. And earlier on, you mentioned about Andy Murray. Andy Murray, after his hip surgery, implant surgery, he went on to play the Grand Slam tennis tournament. That's the highest level of physical performance. So like that, implants are getting better and better. We're able to give function whatever they want. So I must say that the future is very bright for the management of arthritis and specific to joint replacement surgery. Thanks.
Indeed, there is nothing to fear. I wish I could say that in Tamil, but I've learned a new term, which is treatment rumba avasai. Treatment Zaroori hai. That's the bottom line. You've heard it from the doctors today. Don't sit in silence and suffer in silence the pain of osteoarthritis. There are many newer treatment options available, and there is nothing to be afraid of. Because as you heard from the doctors today, life after some of those treatment options, including surgery, can indeed be a life-changing moment for you and a pain-free one as well. Thank you to our viewers as well for being a part of this journey.